Did you know that your body gives signals a month or a few days before you have a stroke? Strokes are undoubtedly one of the biggest causes of death in the world. The strangest part of a stroke is that, although the symptoms usually develop quickly, it can take hours or even days for a person to realize that something is wrong. A stroke is a medical emergency because the blood that your heart is pumping is failing to reach a part of your brain. For some reason, cardiovascular diseases are increasing worldwide, especially among young people. There are some warnings that you should never ignore, no matter how insignificant they may seem. Many signs that occur a month before are subtle, and many people ignore or confuse them with something else. The most important thing is that you know how to recognize them. If you feel any of these signs that you are going to see in this video, see a doctor as soon as possible, because they could be signs that a stroke is about to happen. Today, you will find out the 7 signs that your body gives a month before a stroke and how to prevent this disease and get rid of this terrible statistic. First sign: persistently high blood pressure. If your blood pressure is not well controlled, it can greatly increase the risk of a stroke. Blood pressure is the force of blood against the walls of our arteries. If this pressure is high, it is called high blood pressure. This high pressure can damage blood vessels, and over time, it can cause them to become narrower, weaker, and even rupture. If a blood vessel in the brain ruptures due to high blood pressure, bleeding can occur, resulting in a hemorrhagic stroke. If high blood pressure damages the arteries that supply blood to your brain, it can reduce blood flow and lead to an ischemic stroke. That's how important it is to know if you are hypertensive, and if you are, to treat it appropriately. Make lifestyle changes and take your medications correctly to control your blood pressure. This is essential to reduce the risk of stroke and other cardiovascular diseases. Second sign: excessive fatigue. Excessive fatigue or extreme tiredness can be a symptom or warning sign before a stroke. Remember that fatigue can also have other causes. The fatigue related to stroke is intense and causes persistent tiredness, which may be atypical for you and is unrelated to physical exertion or lack of sleep. For example, excessive tiredness may be related to changes in blood flow to the brain. It could be caused by a narrowing of an artery due to atherosclerosis or a possible clot that interferes with the supply of oxygen. So, if you are feeling unusually tired, see a doctor to be well evaluated. Sometimes, extreme fatigue can precede a transient ischemic attack, also known as a mini-stroke, a warning that there is a temporary problem with the blood supply to the brain. A transient ischemic attack is a transient condition that can be an indication that a stroke is about to happen. The symptoms are temporary, usually lasting a few minutes to a few hours, without causing permanent damage to the brain. Generally, an artery in the brain is blocked, but in less than 24 hours, the body itself manages to dissolve the clot, and the patient no longer has symptoms. However, this is a strong indication that a stroke is about to happen. Third sign: vision problems. If you have any sudden vision changes, it could be a warning sign of a stroke. Blurred vision, double vision, eye problems, and difficulty focusing may also be signs of brain circulatory damage. When vision loss occurs, it may be due to a blockage in one of the arteries that supply blood to the eye. Of course, there are other causes of vision problems, but even so, it doesn't stop you from investigating what is happening. Fourth sign: numbness or weakness in the extremities. Numbness or weakness in the extremities, especially on one side of the body, can be a warning sign before a stroke. This sudden numbness or weakness usually occurs in one part of the body, such as the arm or leg, or one side of the face. One side of the body may lose sensation. These symptoms usually only last a few minutes or hours, but they should never be ignored. Even if it is not a stroke, it could be a neurological problem that should always be investigated. Fifth sign: speech problems. A person who is about to have a stroke may have sudden difficulty speaking. The speech may be slurred, and the person may have trouble saying the words or providing complete sentences. This is called aphasia, which is the difficulty in understanding, formulating, or expressing speech. Sixth sign: sudden and intense headache. A sudden headache may precede a stroke. It is important to note that not all headaches are related to strokes and that not all strokes are preceded by a headache. In an ischemic stroke, a headache occurs due to obstruction of blood flow to the brain. These pains, when they occur, are described as severe and sudden. In a hemorrhagic stroke, which occurs when there is bleeding in the brain, the headaches are also intense and occur due to the bleeding. This type of headache is often described as the most painful. Sometimes, a severe headache can be a sign that an aneurysm is about to rupture in the brain. This is another thing to always keep an eye on. Seventh sign: other neurological symptoms. A person who is about to have a stroke, whether hemorrhagic or ischemic, may have other neurological symptoms. Memory problems, loss of balance, nausea, and vomiting may also be earlier indicators. In other words, they may appear a few days or weeks before a stroke. However, several other differential diagnostic problems also cause similar symptoms. People with seizures, hypoglycemia, brain tumors, anxiety attacks, and infections in the central nervous system may have these symptoms. So always look for a good doctor to be well evaluated. Now you know that interrupted blood flow can put you one step away from suffering a stroke. Other risk factors that can cause a stroke are alcohol and drug abuse, obesity, an unhealthy diet, depression, anxiety, and a sedentary lifestyle. All these factors trigger specific processes in your body that can result in a stroke. In fact, strokes don't always show any symptoms before they happen. That's why prevention is essential. Control your blood pressure, maintain your blood glucose levels normally, exercise regularly for at least 150 minutes a week, eat fresh healthy foods, avoid processed foods, sugar, and excessive saturated fat, control your cholesterol, and keep your checkups up to date with your cardiologist. These actions will prevent you from having a possible stroke in the future. If you found this video helpful, don't forget to like and subscribe to the channel. You can also encourage others to take care of their brain by sharing the video. See you next time.